Welcome to This Week in Psychiatry. This week we are covering 10 notable papers spanning 3 broad themes: novel therapeutic targets and interventions in addiction, the optimization of pharmacotherapy and real-world prescribing patterns in mood disorders and schizophrenia, and the intersection of lifestyle, public health, and psychiatric comorbidities. Let us dive in. We begin with 2 studies offering new perspectives on managing alcohol and substance use disorders, in a large Swedish register-based, within-individual study. Researchers evaluated the real-world impact of GLP-1 receptor agonists on hospitalizations related to alcohol and substance use disorders. Analyzing data from over 167,000 individuals with type 2 diabetes, they found that active treatment with the GLP-1 receptor agonist was associated with a 45% reduction in the rate of alcohol-related hospitalizations and a 39% reduction in substance use-related hospitalizations compared to periods when the same individuals were unexposed. Crucially, the study also looked at what happens after discontinuation, which is a common clinical scenario. For alcohol use disorder, the protective association persisted during the first 182 days after stopping the medication, showing a 30% reduction in hospitalization rates, but this benefit was no longer evident between days 183 and 364. For other substance use disorders, there were no statistically significant protective effects after stopping. For comparison, DPP-4 inhibitors were not associated with consistent rate reductions. These findings suggest that GLP-1 receptor agonists might serve as a powerful tool in addiction medicine, but clinicians must prepare for a return of baseline risk within 6 months of discontinuation. Moving from systemic pharmacotherapy to targeted neuromodulation, a randomized, double-blind, sham-controlled trial published in Molecular Psychiatry investigated continuous theta burst stimulation, or CTBS, targeting the right dorsolateral prefrontal cortex in 50 patients with alcohol use disorder. The investigators found that 2 weeks of active CTBS therapy, delivered twice daily, more than halved the risk of relapse over a 1-year follow-up period compared to sham stimulation. Neuroimaging and network control analyses revealed that the treatment successfully modulated prefrontal subcortical regulation, reducing the control energy required to transition between these networks. This effect was linked to neuroplasticity-related gene expression. While the sample size is small, this trial provides robust, network-informed evidence that non-invasive neuromodulation can induce durable clinical abstinence in patients struggling with severe alcohol dependence. Our next theme focuses on refining how we prescribe and manage medications for major psychiatric conditions, featuring insights from the Lancet Psychiatry and the British Journal of Psychiatry. A major clinical challenge in treating schizophrenia is knowing when to expect improvement across different symptom domains. An individual participant data analysis of 6 antipsychotic trials involving over 2,000 patients sheds light on this temporal course. The researchers found that while all 5 symptom domains of the positive and negative syndrome scale improved in parallel during the first few weeks, some resolved much faster than others. Hostility and excitement symptoms showed the quickest response, decreasing by 76% with a median time to response of just 3 weeks. Positive symptoms and anxiety or depression symptoms followed, taking about 4 weeks. In contrast, negative symptoms and cognitive or disorganization symptoms lagged significantly, requiring a median of 8 weeks to show a substantial response. The clinical takeaway here is vital. Clinicians should not change antipsychotic regimens prematurely when negative or cognitive symptoms persist early in treatment, as these domains require a longer runway to show improvement. Meanwhile, in the search for novel mechanisms for depression and associated cognitive impairment, a phase 2 trial, a brain-penetrant intracellular cortisol synthesis inhibitor. The study enrolled 165 patients with major depressive disorder and persistent cognitive impairment, most of whom were on background antidepressants. Unfortunately, emestedastat did not demonstrate any benefit over placebo on the primary cognitive endpoint at week 6, largely due to a massive placebo effect where both groups improved markedly, regardless of baseline characteristics. However, there was a promising trend toward antidepressant efficacy, with a reduction in depression severity scores that began at week 6 and was maximal at week 10. Clinicians should note that 10% of patients receiving imetelstat experienced mild to moderate transaminase elevations, indicating a need for liver function monitoring if this class moves forward in development. Turning to real-world prescribing patterns, 2 studies in the British Journal of Psychiatry highlight significant gaps between clinical guidelines and actual practice in the United Kingdom. The first study examined over 40,000 patients newly diagnosed with bipolar disorder between 2000 and 2022. Alarmingly, nearly 29% of patients were prescribed antidepressant monotherapy, which can precipitate mania, for at least 1 month in the year following their diagnosis. Conversely, lithium, a gold standard first-line treatment, was prescribed to only 18.5% of patients within the first year, and just 4% received it as first-line monotherapy. Furthermore, nearly half of the cohort switched medications at least once in the first year, indicating highly unstable treatment trajectories. Socio-demographic disparities were also evident, as males, ethnic minorities, and those living in deprived areas had lower odds of receiving lithium. The second United Kingdom-based study analyzed antidepressant change and discontinuation patterns using the UK Biobank database of over 82,000 individuals. It revealed that patients with a depression diagnosis stayed on antidepressants longer than those treated for non-depression indications, such as pain. However, early and late discontinuations were highly associated with comorbid conditions. For instance, patients with recurrent depression were nearly twice as likely to discontinue early and more than 2.5 times as likely to discontinue late. Genetic analyses also identified 2 novel variants associated with early selective serotonin reuptake inhibitor discontinuation and demonstrated a strong genetic correlation between antidepressant changes and underlying anxiety and depression. Together, these studies emphasize the urgent need for more personalized, guideline-concordant prescribing and suggest that integrating clinical and genetic markers could eventually help predict treatment adherence and outcomes. Our final theme explores lifestyle factors, research priorities, and public health concerns, with studies spanning dietary quality, patient-centered research, student suicide, and attention deficit hyperactivity disorder comorbidities. In molecular psychiatry, a target trial emulation using data from over 7,200 older adults in the ASPRE cohort investigated the longitudinal relationship between diet quality and depressive symptoms. Over a median follow-up of nearly 6 years, the researchers found that high consumption of ultra-processed foods was associated with a 12% increased risk of developing depressive symptoms. Conversely, adhering to an anti-inflammatory diet was associated with a 7% lower risk of depressive symptoms. Interestingly, these associations were completely independent of genetic predisposition to depression or baseline low-grade inflammation, suggesting that dietary modification remains a universally valuable, low-risk strategy for mental health promotion in older adults, regardless of their genetic or inflammatory profile. This emphasis on lifestyle interventions is highly aligned with what patients and families actually want from psychiatric research. A James Lind Alliance priority-setting partnership. Carers and clinicians to identify the top 10 research priorities for metabolic interventions. The resulting agenda highlighted a stark disconnect between current academic research and stakeholder priorities. While traditional trials often focus strictly on metabolic endpoints like weight loss, stakeholders prioritized understanding the mental health outcomes of dietary and lifestyle interventions, the mechanisms linking metabolic changes to brain function, and the broader metabolic effects of psychiatric medications beyond simple weight gain. This serves as a call to action for researchers and funders to align future clinical trials with these patient-centered priorities. In the realm of public health and safety, a national retrospective case series published in the Lancet Psychiatry examined the characteristics of 107 higher education students in England who died by suspected suicide during a single academic year. Among the cases with available data, the vast majority of decedents were male undergraduate students living away from home. The most common pre-death features reported in serious incident reports were mental health difficulties, academic struggles, and neurodivergence, which was present in 41% of cases. Although nearly 70% of these students had some prior contact with university support services, the reports revealed systemic failures in information sharing, monitoring engagement, and coordination between academic and pastoral teams. Furthermore, universities rarely involved families in serious incident investigations, doing so in only 24% of cases. These findings underscore the need for campuses to implement targeted support for neurodivergent and struggling students, secure student housing, and establish transparent, family-inclusive postvention review processes. Finally, a cross-sectional study in the British Journal of Psychiatry, involving over 82,000 participants, explored the symptom-level relationship between attention deficit hyperactivity disorder and compulsive sexual behaviors. Using network analysis, the researchers found that core attention deficit hyperactivity disorder symptoms of inattention and hyperactivity impulsivity acted as central, bridging nodes that directly connected to compulsive sexual behaviors and problematic pornography use. This network architecture was consistent across different age groups, sexes, and gender identities, though the associations were stronger in men and cisgender individuals. For practicing clinicians, this means that compulsive sexual behaviors should not be viewed in isolation. Addressing executive dysfunction and reward dysregulation through targeted attention deficit hyperactivity disorder interventions may be a highly effective transdiagnostic strategy to alleviate these distressing compulsive behaviors. If you only have time for one paper this week, make it the Swedish register-based study on GLP-1 receptor agonists. This paper provides critical, real-world evidence that GLP-1 receptor agonists are associated with a substantial reduction in alcohol-related hospitalizations, while also delivering a vital warning that this protective effect rapidly wanes within 6 months of discontinuation. Here are the key takeaways from This Week in Psychiatry. First, GLP-1 receptor agonists significantly reduce alcohol-related hospitalizations, but clinicians must monitor patients closely after discontinuation, as the protective effect disappears after 6 months. Second, when initiating antipsychotics for schizophrenia, reassure patients that hostility and positive symptoms improve quickly, within 3 to 4 weeks, but advise them that cognitive and negative symptoms require at least 8 weeks to show a meaningful response. Third, real-world bipolar disorder management in the United Kingdom continues to deviate from guidelines, with high rates of potentially harmful antidepressant monotherapy and severe underutilization of lithium. Fourth, in older adults, reducing ultra-processed foods and adopting an anti-inflammatory diet lowers the risk of depressive symptoms, independent of genetic risk or baseline inflammation. And finally, neurodivergence is a major risk factor in student suicides, highlighting the need for universities to design targeted support systems and improve coordination between academic and mental health services. That's your roundup for This Week in Psychiatry. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.